Hi there, and welcome to this channel. I'm Sydney Dupuy, and I'm your functional medicine metaguide. So the video today is part of a series I've put together called Pulling the Curtain Back on Hormone Replacement Therapy, or HRT. And today we'll be talking or looking at whether or even when a woman might be too old to take HRT, and maybe she should come off, and what is exactly the outdated information that is still circulating? So let's find out. So there has been a rumor going around for about 20 years, and it's time, in my opinion, to put an end to it. Just this week, one of my clients said, well, I guess I'm too old to start hormone replacement therapy. And she is 72. And she, along with many other, actually a whole generation of women, have been basically denied the opportunity of receiving HRT as they've moved through their menopausal years. So that means about 32 million women have been denied and continue to be denied the access to HRT, and most don't even know that it's an option to improve their quality of life. So things like UTIs, vaginal dryness, atrophy, decreased intimacy, joint pain, osteoporosis, heart disease, the list is long. Cancer, plantar fasciitis, elevated cholesterol, sleep, moods, brain health, blood sugar regulation, and weight can all be improved by HRT, and all can contribute to a woman's quality of life. So that all sounds good, right? So why have women been denied access? Well, once the premature results from the infamous WHI study, which was called the Women's Health Initiative study, came out in 2002, not 2022, which is about over 20 years ago, stated that HRT caused breast cancer. And since then, doctors have been hesitant and resistant to prescribing hormones other than birth control pills, and women have been afraid to take them as well. So the topic, as a result of this, as a result of the study, the topic of hormone replacement therapy and the care specifically of postmenopausal women, it has not been included as part of the medical school curriculum for more than 20 years. And again, that currently affects over 65 million women in the US. And that's a lot of women who most likely are receiving subpar care and are seeing a decline in their overall health, which affects their quality of life. So if a doctor has come through the ranks of medical school during the last 20 years, that puts them between the ages of 28 and 50, give or take. And I don't know about you, but I know that most of the doctors that I go to are between those ages, um, which means that unless they've sought education outside of medical school and mainstream medicine, their knowledge about menopausal health and HRT is very limited. So it's been a long road to change the negative narrative that came out in 2002. The initial results of the WHI study has been gone over again and again, and there's been follow-up with participants as well. And there's even a study that they have named the WHI-2 study, which basically is a study where they've taken the data from the original study and reworked it into an entirely different narrative. And how can that be, right? Well, statistics can be very tricky, and I'm not going to go into it here, but when you hear something, you have to know what the actual numbers are that they're talking about to extrapolate really what the statistics mean. So the re-examination of the data, some done by the original WHI authors, along with other studies, show that HRT is safe as well as beneficial and does not cause cancer. By the way, the average age of the WHI participant was 63. So it was overpopulation that they did this huge study on, again, over 20 years ago. So have there been any randomized studies or trials to support putting women 10 years out from menopause on HRT? Maybe not specifically, but there is still a lot of data to support it. As recently as this April, which would be April 2024, an observational study of 10 million women over the age of 65 was published. So this study points out to the fact that estrogen actually reduces all-cause mortality by 20 to 30%. That's significant. And it shows a reduction in cancers by 20%. So this is basically the biggest study, and again, it's observational. It is looking at the information that our Medicare system has collected. And of course, that means it is on women who are 65 years and older. I do think it's important for all women to have a good understanding of the WHI study, to be able to better understand what types of hormones were used, which are very different from what's available to us now, and how the different types of hormones have been used interchangeably, and you really can't do that. You've got equine horse hormones and progestins versus the bioidentical hormones, estrogens and progesterones that are available to us today. So it's really important to always understand that in order to be able to kind of hear when people do talk about hormones, really what they're talking about. So I can't really go into the details of the WHI study here, and there is a lot to look at, but for an in-depth summary and much more, I do invite you to watch my video, my YouTube video that I have posted here called Pulling the Curtain Back on Hormone Replacement Therapy. So it gives you a really good rundown of all of that. So coming back to women who are, 60 and older, whether or not they should be still on HRT or even beginning HRT, in the 2022 NAMS, which is North American Menopause Society, and their statement on hormones, and they're very influential and well-respected organization, they did change their position on the length of time for using HRT to indefinitely, and if it's deemed safe by their health care provider. And the narrative, again, up until just recently, has been to stop HRT in women 10 years after they reach menopause, and to not start women on HRT if she's 10 plus years from the onset of menopause, and to use the lowest dose possible. So times are changing. It's been a very, very slow process. And most providers are still very, very conservative in what they prescribe for women and how they prescribe it. So what do we know for sure when it comes to HRT in women older than 65? Well, we know that estrogen receptors do not die. Estrogen receptors do kind of go dormant if not used, not stimulated, but they're still there and can be coaxed slowly back. They are still viable, which means hormone replacement can still restore every tissue or help every tissue in a woman's body at any age. We know that vaginal estrogen can help with UTIs, bladder health, vaginal atrophy, intimacy, and this use is supported. Its use is supported again by NAMS and other organization in 60 and older women. So vaginal estrogen alone is not so much vilified so much anymore. I think a lot of women don't realize that that's an option, and they do have to ask their doctors for it. And even in the world of cancer, once treatment maybe has been completed or you're well into it, that vaginal estrogen is well supported as a means to help a woman feel better down in her lady parts, which is important. We do know that both estrogen and progesterone help with keeping our bones dense and strong. We want to avoid osteoporosis. Estrogen also helps to make collagen, and there's collagen throughout our bodies, and it's part of our tendons and ligaments. So we see improvement with knees and shoulders and feet. And there is published data that shows if you put estradiol on skin, in just 2 weeks, you'll see a reduction in wrinkles. And, that's the exterior part of it. I think we still want to look good as we get older, but the benefits from estrogen, excuse me, and progesterone are definitely underneath the skin. So, we can't change time. We can't reverse all of the damage that perhaps has occurred in a woman who hasn't had the benefits of HRT since the beginning of her menopausal years, but we sure as heck can slow some things down and make a woman feel more vital, sharper, happier, and have better sleep and have better bone density, metabolic health, fewer AFib episodes, and cardiovascular events, and a slowdown of dementia, no matter what age the HRT is started. So it's about 3/4 or 75% of postmenopausal women do not take hormones, and most of them, unfortunately, have never been offered them. So some of my older clients have benefited greatly from the use of HRT when it comes to bones, urinary tract health. Wow, that's a big one. Brain and cognitive benefits, and not to mention again the AFib and skin appearance. So every woman, along with her doctor, has to decide for herself whether HRT is right for her. But she needs to know that there's even an option to begin with, right? If you don't know if there's an option, you don't know what to ask, you don't know what to ask for. It's important to find a doctor who is willing to listen and learn, or think about working, or and you need that, but you also might want to think about working with me as well. I am an advocate for my clients. I do like to teach them about hormones and then guide them to what they might ask for that could benefit them. And if you do want to work with me, there is an annoying pop-up that comes up on my website to schedule an introductory call with me, and the link to my website is in my bio here. So I hope this is helpful, and if you enjoyed this video, please hit the like button and be sure to subscribe to be notified when I add more videos here on menopause and perimenopause and in health in general. And please remember that nothing you hear on this channel takes the place of working with your personal healthcare provider, and this is for informational purposes only. All right. Thank you all. I'll be seeing you again soon.